Dumsile, good morning, and thank you very much for your time. I guess one of the things at this time, just overriding everything on my mind, if you've got small kids, is how do you make sure, besides the anxiety, that they don't get really traumatized by what is happening? Because movement is now limited. They can't go out and play in a park with friends. They can't even now socialize with their schoolmates and stuff.
Thank you for the opportunity. I think as parents and caregivers, it's very important that we remain calm. Whilst the situation is quite serious, we need to be calm and show that we are in control in front of our children. Because if we are anxious and feel out of control and overwhelmed, it's going to translate to them. So we need to talk to them about the coronavirus, that it is serious, it can make us sick, but most importantly, talk to them about what we can do to protect ourselves.
Now, this guide that is around, is available. What would it be saying? What would you be guiding? How are you guiding the parents and the caregivers to deal with this with the children?
So the guide would initially talk to parents or caregivers to be able to explain to their children what the coronavirus is. And we need to remember that we have to talk to children in a manner in which they can understand. As a parent, you know the level of comprehension your child has. You know their ages and how they understand things, but you're giving basic messages that it is a virus, it's something that makes you sick, and also talking about the symptoms that you might have when you are not feeling well because of this virus. But most importantly, we are telling children that if you're not feeling well, then you need to tell your mom or dad or someone who's looking after you. The guideline will also talk to parents about measures that we can take at home to protect ourselves. So as we know, the hand sanitizers are not really that much available anymore, but we must be talking to our children about washing their hands, using soap and water. And I think it's important to show exactly what we are saying, not just talk to them, but as caregivers, show them. Wash your hands for 20, 30 seconds. Do that with your child so they can see what you mean and how it is done. When you're coughing, use a flexed elbow. You do exactly that with your child. So we need to be good examples. When you're coming home from work, as a caregiver, you should be the first person washing your hands before you interact with everyone at home. Keeping distance, you know, we talk about keeping distance, but what does that mean for a 5-year-old? So you need to show them exactly, if I'm saying you must try and keep distance 1 meter, how far is that? You must be able to show that to your child as well.
Yeah, I mean, especially small children, some of them, they like to be hugged. When they bump themselves, they want to run to mommy or daddy or uncle or koko or mkulu, and they want that hug. It's going to be a very difficult one at this stage to do, but it's important that you make them understand what is happening, especially if somebody is sick in the house.
Exactly. Very, very important. And it's having those conversations with our children. So it's not like we don't care for them. We don't want to give them those huggies that they like very much. But it's to ensure that we are all safe and we're keeping healthy at home.
Yeah, there's a role here. You didn't cover it because we're focusing on the health side and the safety. But I was just thinking now, Dumisile, because of so much stuff that's being shared on social media, we as parents and big brothers and big sisters, we get stuff on WhatsApps that are showing all kinds of visuals. I mean, and some of them are fake, and some of them, you know, they can be gory. We shouldn't be sharing that with our children at this time.
Certainly not. I think we need to protect our children from all those things. As adults, we have the ability to decipher what is correct and incorrect. So we need to protect our children from all those messages. And we need to just make sure we share the basic information to keep them safe and not to create anxiety for them.
Yeah, where can a parent who's watching us now access that Childline guide that you've created?
So parents can go to our website, which is www.childlinesa.org.za. But I also encourage parents to contact our helpline just to be able to talk to a counselor. So we are not experts at all in terms of providing health messages, but sometimes you need to talk to someone and you want to know where you can go for help. Same as children, they are at home, they might need to talk to someone and find out what to do. The Childline toll-free number is available, which is 08000 55555.
Thank you.
We also have an online service which you can find from our website.
Thank you very much, Dumisile Nala. Thanks for the time there.